Good morning, everyone. This is Roger Bearden, Executive Deputy Commissioner at the Office for People with Developmental Disabilities. This is the quarterly meeting of the Developmental Disability Advisories Council being conducted as an open meeting consistent with the Open Meetings Law and obviously done virtually given the current environment that we continue to be in. I would at this point like to pass the mic on to Nicholas Cappoletti and Michele Juda, respectively the chair and vice chair, to lead the meeting. So at that point, I'll throw it over to you, Nick and Michele. Thank you.
Thank you, Roger. Good morning, everyone. I just want to express my appreciation for all of those of you who have decided to join us today and give of your time and energy and make this a productive meeting of the DDAC. We've got very good representation across the state. We have a number of new members who have recently joined us. And what I'd like to do before we, well, as part of the agenda, we'll do it after I quickly go over the agenda, is actually ask them to each very quickly identify themselves. So that the public knows who's on the DDAC. But before we do that, let's just talk a little bit about the agenda. We're going to begin the meeting with some comments from Opwdb on the 507 forum and planning process. As you are all aware, the 507 is the key planning mechanism to identify the needs of the individuals that are supported by Opwdb and getting representation and feedback from all the stakeholders is critical for us having a robust plan that meets the needs of the individuals that we serve. So we're going to have Roger provide us with some input on that along with his team. We're then going to actually have a discussion by the DDAC on the 507 planning process. Michele is going to lead us in that discussion. The next topic that we're going to talk a little bit about is the DDAC's role in regulatory oversight. And we have a couple things there to discuss. One is the statutory obligation of the DDAC to provide commentary on new regulations. But then also as part of that, we do need to discuss some recent legislation that was passed in April, a bill sponsored by Senator Mannion on the DDAC actually providing some input on Opwdb's response to COVID. So we'll talk a little bit about that later. Then we're going to take a break between 12:30 and 1 o'clock. The link will remain live during that break, so there's no need to reconnect if you don't want to, but it will go silent from 12:30 to 1 o'clock. And then at 1 o'clock, we'll shift the discussion, and Michele will actually be filling in for me and lead this. We're going to be seeing a presentation from Opwdb on the Fmap opportunity, which is, for those of you who are not familiar, Fmap is a significant amount of federal matching funds that New York State is going to be able to take advantage of as a result of the recently passed COVID relief bill for the country. It's administered by CMS. So we're going to be discussing that opportunity, and then also Michele will facilitate the ADC's response to that. And then there'll be an opportunity for public comment, and we know we have a large number of members from the public being able to participate, and we're very appreciative of that. So before we get started, like I said, we have a number of new appointments. In the last meeting, while some of these individuals were in place in participating, we actually didn't have the opportunity for them to introduce themselves to the public. So what I would like is, I'll go down a list of names, just call out some of the members. I'd like to ask you to very quickly just give your name, region of the state you're from, and whether or not you're a parent, provider, professional, what your affiliation is. Please keep that less than 20-30 seconds so that we can get on with the bulk of the meeting. So I'll just start. My name is Nick Cappoletti. I am a parent of a 30-year-old, and I also am the CEO of Life Plan, which is one of the 7 CCOs. Michele?
Hi, everybody. I'm Michele Juda. I am a parent of a 20-year-old with an intellectual disability and a history of very complex skilled nursing needs and medical complexity. I'm also the executive director of Parent to Parent of New York State, and I'm from the Capital District region.
And I failed to mention I'm from Central New York. Stuart Flum?
Good morning. I'm Stuart Flum. I have a son who is 28 years old, clearly with supports and services through Opwdb. I'm in Brooklyn, New York. I'm a financial planner for people with disabilities.
Thanks, Stuart. Susan Hetherington. I think Susan's not on. Robert Pikovsky. Okay, Donna Colana.
Donna is on. Give me 1 second to unmute her.
Okay, are we running? Can people unmute themselves, Josie?
Most people can unmute themselves. We have a couple people that I'm having a hard time moving over to panelists. They won't be able to. So far, it's Donna and Stephanie Speaker that I have to unmute. But Donna, you should be unmuted.
Yeah, thanks, Josie. I was having trouble unmuting. I don't know if it's on my end or what's going on, but hi, everybody.
It's on the WebEx's end. It's not you.
Oh, okay, good, because I always think it's me. So, anyway, hi, everybody. Thanks, Nick, Michele. I'm Donna Colana. I'm the CEO of Services for the Underserved. I've been on the DDAC for a while, and I'm on the Systems Subcommittee with Michele and Dolores as chair. And I look forward, want to welcome all the new members again, and I look forward to the work we're going to be doing today. Thank you all.
Great. Thanks, Donna. So, Josie, are we going to have difficulty members themselves, or can you keep up? I'm kind of just going down the list.
If Donna and Stephanie keep their telephones muted, they hopefully will be able to unmute whenever they need to.
Okay, great, great. Margaret.
Yes, Margaret Puddington. I'm a parent of a man who's 40, it's hard to believe. And I'm the chair of the Opwdb's Statewide Family Support Services Committee, and I'm from Manhattan.
Thanks, Margaret. We both share sons by the name of Mark. Is Janet Chisholm on? Janice?
I don't see her on, Nick.
Okay, okay, great. John Maltby.
Hi, John Maltby. I'm a parent. My son is 47 years old. I'm in Region 4 and Region 3, and I'm co-director of the New York Housing Resource Center, and I chair the residential committee of the Advisory Council.
Thanks, John. Thanks. Dan Brown. I know you're on.
Hi, Nick. Michele, thank you for that. I am a new member to the DDAC. I'm also in the Finger Lakes area and have a daughter, Hannah, who is 32. She would claim she doesn't have disabilities. She would claim she has abilities. And I am also the executive director of RACR, which is a provider in the upstate New York area. Thanks.
Thanks, Dan. Kai Roman.
Hi, good morning. I'm Kai Roman. I'm in the Bronx. I have a 19-year-old son who's on the spectrum, and I currently work in a primary care office where we have DD patients. And this is my first time on the council, so thank you for having me.
Welcome, Kai. Suzanne Levine.
Good morning, everyone. I am Suzanne Levine. I am also a new DDAC member. I'm the Director of Community Services for Franklin County, which is in upstate in the North Country area. I'm also a member of the Conference of Local Mental Hygiene Directors. So thank you for inviting me to sit on the committee, on the council rather, excuse me.
Thanks, Suzanne. Leah Steinberg.
Okay, I live in Brooklyn and I'm a parent of an adult with autism serviced through Self-Direct. And my other hat, or the other part of my life, I'm a liaison for students with disabilities to government to help them get what they need through the education system.
Thanks, Leah. Janice Fitzgerald.
Hi, I'm the parent of a 36-year-old and I live in northern New York, Franklin County, about 20 miles from Lake Placid. And I've been involved in various parts of New York State government for quite a few years. I also serve on Environmental Conservation Department's Access to Recreation Committee. Thank you.
Great, thanks, Janice. Barb DeLong.
I haven't seen her yet.
Yeah, she may, I know she may not be able to make today's meeting. Jerry Athenas?
Yep. Yes. Hi. Good morning. I'm Jerry Athenas from Long Island. I'm a parent of a 36-year-old, and I'm involved in a lot of the family advocacy groups here on Long Island for the past 20 years. Thank you.
Thanks, Jerry. Shamika Andrews.
Hello, I'm Shamika Andrews. I am from the Capital Region, and I am the Community Outreach Coordinator for the Self Advocacy Association of New York State.
Great. Dolores McFadden.
Hello, good morning, everyone. Can you hear me?
Yes.
Okay, so I live in Orange County, that's the Hudson Valley DDRO area. I'm a licensed behavior analyst, and I've been on this panel for some time now, several years.
Thanks, Dolores. Stephanie Speaker, I know you're on the phone, so you may need to unmute.
Hello, my name is Stephanie Speaker. I'm a self-advocate for people with developmental disabilities. I'm 50 years old. I have a disability myself, and I'm from Buffalo, New York.
Thanks, Stephanie. Maya Wertheimer.
I'm on this panel. I hope you're hearing me.
We can hear you now. Why don't you start over again, Maya?
My name is Maya Wertheimer. I'm a new appointee. This is my second meeting that I'm participating. I live in Orange County. I'm a parent, would be, my son would be now 43 years old, who is deceased, unfortunate. I am the executive director of NYSHA, which is New York State Hospice Association, serving downstate Hudson Valley region. I'm a council member on the Family Care Council, New York State the Commissioner's Council for Family Care. I am a member appointed by the Rockland County Exec on the DD committee, and I'm an advocate for people with disabilities.
Great, thank you, Maya. Paul Joslin.
Good morning, Paul Joslin. I'm the Executive Director of Access CNY based in Syracuse, serving the Central New York region. I'm happy to be a new member of the Ddac as well as the Systems and Residential Committees.
Great, thanks, Paul. Valeria Valdez.
Good morning, everyone. My name is Valeria Valdez. I am from the Capital District area. I have a 14-year-old son who is in the spectrum, and I am a new member of the DDAC committee.
Great, thank you, Valeria. Gary Goldstein.
I'm the founder of the New York State Task Force on Special Needs Dentistry, and I chair the Health and Wellness Committee, which has groups that involve, look for recommendations involving medical, dental, and behavioral health issues.
Very good. Thanks, Gary. Sumatra Sarkar.
Hi, can you hear me?
Yes.
Hi. Hi, my name is Sumantra Sarkar. I'm a new appointee. I'm so happy and glad to be in this committee to learn from all of y'all. I have a special son, son with special needs. He's 24 years old. And on a personal front, I'm a faculty at the School of Management at Binghamton. I'm from Broome County.
Very good. Thank you, Sumatra. Luana Jones.
Hey, good morning. Trying to start my video, but I'm sure you can hear me. I'm Luana. I'm a new member to the DDAC. I'm also a parent of a 32-year-old with autism, and I'm also the founder, executive director of the Autism Council of Rochester. I chair the Office of Mental Health, Community Services Board, and also chair of the DD Subcommittee. Thank you.
Well, thank you. I know we have a couple of ex officio guests. Vicki, are you on from DDPC?
I haven't seen her name.
Okay. Melissa Stickle?
She's here.
Okay. All right.
Are you able to unmute, Melissa?
Melissa, you're unmuted currently.
All right. Roger, is there anybody else from OPWDD that you'd like to?
I think we can just include them as, Commissioner Kastner is here with us, as well as members of our senior team. But as we get input from various folks, we can certainly do that just in the interest of advancing.
Very good.
This is Josie.
Okay.
We also have Janice Chisholm on, but she's just having an issue speaking or chatting, but she wants everyone to know she is present.
Very good. And did I miss anybody? I want to make sure I didn't miss anybody who's on the council that may not have been on the list. Okay. All right, Roger, I think first agenda item is 507.
Great. So I think my role here is to outline a little bit of the process, and then I know that you and Michele were going to kind of help lead the DDAC through a discussion of priorities and so on. So in terms of the process, Mental Hygiene Law 5.07 provides that OPWDD is to engage in collaboration with the Advisory Council a construction of an annual 5-year plan. So, that's a plan that looks out 5 years. And I believe that the final plan is submitted to the legislature and the governor by November 1st. The efforts we have to write this plan launched some weeks ago in the middle of May through the announcement of some public forums, as well as specific engagements that we have with constituencies, organized stakeholder groups, provider groups, et cetera. And there have been a number of public forums, including one, I believe, last night and one tonight, if I'm not mistaken. And there is an OPWDD website, a web page on strategic planning that has both, when and where those hearings are taking place, of course, again, virtually because of the nature of the environment we live in these days. And as those meetings occur, there are postings of what happened at the meeting, the videos, as well as there's always a little lag, but then there would be a transcript as well and translated into relevant languages. So that process is moving forward. In addition, we have a website, an email address, planning@opwdd.ny.gov. We can put that into the chat for all the participants, where we are receiving written submissions as well. And then obviously getting feedback from a number of quarters in terms of, where they think the system should go, where it could go, et cetera. And then the plan then in terms of a time frame is that stakeholder engagement will continue through really the end of June. By July, into July, our hope is to begin to really synthesize all the comments received in the interests of by shortly after Labor Day, we would be publishing a draft plan. The statute provides that we should first publish a draft plan, which would be subject to at least one public hearing, and would be the topic also for the DDAC's consideration at, I believe, our September meeting. But the goal would then be to test the ideas through the publication of a draft plan, say what we heard, say what we're planning to do as a consequence of those stakeholder inputs, and then, certainly get the feedback in the interest of then finalizing a plan by that November 1 deadline. So I don't know if Nick or Michele, you wanted anything further in terms of process before you had more of a substantive discussion, but let me know.
No, thank you very much, Roger. That's helpful. I think we'll just open it up to the council if they have any questions or comments on Roger's comments.
Nick, can I jump in just before we do that? Sure. Roger, have there been, I know that it's, you've had 3 of the 5. I think the 4th happened last night, as you said. The 5th is happening this evening of the forums. Have there been any learnings that OPWDD has been taking away before we discuss our thoughts on that? I'm just curious as to how OPWDD has been receiving it and what you've been hearing.
Sure. So that's a great question, Michele. A couple of items. One is I do think we've been very pleased by the level of engagement. So, being able to reach folks who may not previously have, participated or shared their thoughts. I think there's some real significant advantages actually to the virtual forums, because I think they're accessible. People can afford maybe a few minutes out of their busy lives. Often we're talking about people who have disabilities or caring for people with disabilities. And so, the ability to attend a meeting and take that level of time out of their life is perhaps more limited. So we've certainly heard from many voices of people that, we haven't heard from before. So that's an incredibly positive outcome from our perspective. I would say the overwhelming majority of comments have focused on workforce issues, and those have different manifestations depending upon the interaction that the particular individual or family may have with the service system. So they may have different support needs and different ways of receiving those supports. But there does seem to be a pretty consistent set of concerns around the availability of workforce to provide needed supports. So I would say, we haven't, done that synthesis yet, but if you're asking for an anecdotal kind of response, I would say that would be a very strong voice. Commissioner, I don't know if you wanted to add something to that. You have been at all of those for the full part.
The only comment I would make is that I think there's 2 ways to look at the public comments. One is around specific content areas, which we'll go back and take apart each individual's testimony and try to identify specific content areas so that we can highlight what the major concerns are. But the I think very important to me have been kind of the emotional content of the presenters' comments. It's a very difficult process for many families in preparing their testimony and making public statements, they've had to address, I think, a lot of concern, anxiety, fear, worries about the future. And I don't want to lose that. If we come back with a table that describes, X percentage of speakers spoke about, topics A1, 1, 2, 3, I don't want to lose the real emotional content of what we're hearing, that this is a really, really important issue for folks. They're very concerned about the future. And we're going to look at a means of trying to capture some of that content in the final report so that it's not lost.
Commissioner, I have to jump in and just say that I am so appreciative of hearing you say that. I was really hoping to hear it. As you know, I testified at the Region 3 Forum. Last night, I listened via the YouTube links to Regions 1 and 2. I will be listening to 4 and 5. But the thing that really stood out to me as the forum in Region 3 progressed was that emotional storytelling. And I was really hoping that that was not being lost. There was a self-advocate, who was speaking so dearly of her mom. I believe her dad had recently passed away, and she was so worried about what was going to happen to her mom as an aging caregiver and the worries that her mom had. And it just really stuck with me. And then as you were closing the forum in Region 3, the last person who had testified, who got through her comments, it was, you could hear in her voice how difficult it was. She was wiping tears away as you were closing. And I'm really so pleased to hear that you picked up on that. I was hoping that was not lost.
No, it wasn't lost. I've been a pediatrician for too long not to hear people's, true concern over the well-being of their loved ones. So we don't want to lose that. I think it's a really important part of what we should bring back to the public and to the legislature.
Yeah. Thank you for that. Roger, I have another process question before we go back to the council. Can you speak a little bit more about what's in line for the upcoming stakeholder, the one-to-one meetings that you're having over the summer with various groups? Where are you in the planning? Who are you meeting with? Who's going to be represented at those meetings?
Sure. So we've tried to be inclusive, so as we are aware of what I would call organized stakeholder groups, right? So we, and we've been trying to engage also groups that may not have had a seat at the table, and our agency has a strong organizational emphasis on diversity, equity, and inclusion. So we're trying to reach out to groups that may represent particular linguistic or racial or ethnic minorities, groups that, I can think of several groups that we'll be speaking with who, where the primary language is not English, and we're trying to engage those groups in the languages that they do speak. So we're trying to be inclusive. Obviously, if we don't know that a group of folks organized around developmental disabilities issues exists, it becomes very difficult for us to meet with them. We are using essentially the same or similar format to the one that we're using for the regional forums, which is an effort to share some information. That's the PowerPoint that has been used in a way to make sure that folks have an understanding of some key issues that we're confronting, because not everybody comes to a discussion with the same level of information, while at the same time trying not to tell people what to think, right? There's a balance there. So we are doing those discussions. I think last time I counted, it's over 30 or 35 of them that we're going to, that we have booked at this point. And, the way we're accomplishing that is having different members of Opwdb leadership, take on those meetings. It's not feasible, obviously, for one or two people to do that level of discussions. But what we are doing then is documenting. So we are taking notes of those discussions. We're still working through exactly how we would, synthesize those. Certainly we want to be protective if people are sharing information about their own loved one situation that they may not anticipate, you know, the world learning about. We're not going to be sharing people's specific information. But so we, you know, our intention would be over the next number of weeks, and we can certainly talk with the Ddac about how to share that information to you know, to be synthesizing into some format. I think the commissioner's point is, you know, sometimes a synthesis of that nature can lose the emotional flavor of it, right? Because if you're saying, well, you know, 10 parents commented on the following topic, you know, you're probably not going to capture, you know, the feeling of that. So part of that is wanting to make sure how do we also understand the that element of it. But the hope would be by, I'm going to call it mid-July, you know, depending upon our speed in doing this work, to have really synthesized what we've heard in a way that can then inform, you know, the composition of draft policy responses. So, you know, so what are we going to do about it? And I know we're going to talk a little bit about the Fmap this afternoon, but this also is going to help feed into our, you know, our ideas around how those one-time funds might be invested.
Great. So I just want to open up to members of the council. We had asked our council members to participate in one of the forums, likely the one that's, you know, in their region and closest to them. 4 of them have happened. Just want to open it up if anyone has any comments, having attended, about themes you were hearing or points that you want to make sure are emphasized back to Opwd leadership this morning.
So, hi, this is Donna. I apologize.
Oh,
never mind.
I just wanted to know, Michelle, can you see who has their hand up when they have them up? Or do you want me to call them out to you?
If you could do that, that would be great, Josie. Thank you.
Okay, we have Valeria has her hand up.
Was that Leah?
Valeria.
Oh, okay, Valeria. Valeria, I think. Valeria. Can you unmute Valeria?
Can you repeat the question? I'm so sorry.
Oh, okay. You don't have to speak, Valeria. We were just asking if members of our council had any feedback, having attended a forum, anything that you noticed as a theme that you wanted to point out to the leadership of OPWDD. Your hand was up, so Josie was thinking you wanted to speak.
Oh, I'm so sorry. It was a mistake, but I already submitted my comment.
Okay.
Yes.
Thank you. Thank you.
Thank you, Michelle. Thank you.
Yep. Anyone else? Josie, who else has a hand up?
No other hands.
Donna,
Josie, my hand is up. I don't know if you can see it. It's Donna.
Go ahead, Donna.
Okay, I have it up. I don't know. I can't get my video on either. I don't know what's going on. But first of all, I agree with both Roger and Ted. I only attended one last night in New York City, and I was very impressed in a 3-minute period how the family members really concisely presented some of their major concerns. So, and it was emotional, and I do think workforce was a huge piece of it. I would say the other themes, at least that came from New York City, was around data decision-making related to transparency of data, everything from the needs of individuals in the system and flexibility was another theme, which I don't think is new to us in terms of real time, speed with respect to sort of meeting people's needs. So I think those were really critical areas that we should sort of try to advance.
Great, thanks, Donna. Does anyone else want to make a comment?
Dan, do you have
Michelle, I'm sorry, but I took it down because Donna went through the exact 3 things that I was thinking about. So, I'll just reiterate those, and then maybe add 1/4, which was there were definitely some people last night. I've been on 3 of the 4 calls who talked specifically about self-direction, which was more in that session than the other ones I was on.
Okay, great. I haven't heard that one yet. I'll add from the ones that I listened to. I don't want us to be remiss in not pointing out. I also heard a lot about crisis service and complex, right? People with complexities of any sort, and the planning around that, and being able to innovatively plan around that.
Michele, if I could, I just wanted to, on the data point, I'm just going to put into the chat room for everyone a link to the data that is available on the Opwdb website. We are very committed to improving the amount of data available. In fact, there will be additional data that I believe will be up and available within, I think, the next several days. But I wanted folks to have that link for it, and so what we're trying to do is typically part of the 507 planning process, and I neglected to mention this as part of the initial summary, is we do engage also the local counties through a planning process that we, and one of the things that we do is we provide data to those counties to help them. They make recommendations as well to Opwdb. This is part of the process. So what we are doing now is making available, and this is what's going to be up on the website very shortly, the same data set that is made available to the counties will be made available, generally to the public. And then, we regard this as a kind of year-to-year exercise. So next year we would be, looking as part of this process to say to what degree, is the data we're making available useful and relevant? To what degree, are there recommendations to be made to, enhance the data that would be available? And so, we would certainly welcome critiques, comments, areas of amplification. We are very much committed to making as much data available as possible that we may have.
Great, thank you. All right, so I'm going to transition over. We want to have enough time to hear from the committees.
Michele, it looks like Sumantra has a.
Oh, sorry. Go ahead, Sumantra.
Thank you so much, Roger. Okay, Roger, thank you. I think you shared this website before, and I went through the website. Now, one of the comments that I had, and I know we are supposed to work on it, is that the data is at a very aggregate level. Okay, if you say, for example, if you want to go ahead and sort of prioritize which one should we, and we have priorities, right? We have residential, we have health, and all, where it doesn't go to that detail level. Aggregate data is just at the county level. I have a spreadsheet which I did some analysis on that on my other computer. So it's at the county level. So if we have to make a plan and think about, we have a pot of money, we do not infinite money, but if you want to prioritize which one did we go for the last year, where was it spent more, and then based on the basic needs, should we use that pot of money? So that would be our suggestion. So if we could get some more granularity on the data, I know you are working on it, that would be really great.
Yeah, sure. I think what I would suggest is, why don't you, and I didn't recall, I share that,
last time, yeah,
that I shared it previously, so I appreciate that. If you could take a look, I'll try to, I had hoped to have that data up, before this meeting, but it just takes some time to translate it into sort of web-friendly form. Take a look at that, and either yourself or the committee as a whole, or however you want to say it, if there's additional ways of getting or receiving the data that would be, useful, just let us know, and we'll see what we can do. One of the barriers we do sometimes find is that there's data that we would like to have, but we don't actually have it. So okay. It's not a failure to share, it's a failure to have. And so that's a different type of problem, but we're absolutely, we regard this as public data. We regard it's public expenditures on public services. So it's public, data. So that's the goal here. So we just appreciate any areas where you say it could be improved.
Perfect. We'll sort of have a meeting, and then we'll sort of ask you what are the requirements and what type of data you need. Thank you. And secondly, I sort of want to add on to this point. I just wanted to be clear because I'm new and might be a dumb question. So we're talking about 5-year planning, right? Now, the way that I'm thinking is that the 5-year plan, and then we wait for 5 years, another plan, or are we going to do every year and have a rolling plan which sort of sees where we are and then sort of modifies the idea? Is that the plan, or are we talking about?
Yeah. Yes. So it's a terrific question because it has been asked actually a number of times. So, we have not, as an agency over the last number of years, issued a 507 plan, and that's, an area where we have room for great improvement. Our anticipation is that we would be looking out 5 years every year. So you would be, it's a planning process, not a planning document. How that's going to manifest, I'm not entirely certain. I mean, I think the idea would be that the plan might have I think in 1 year, 2 year, and 5 year, right? Short, medium, and long, if you will. And then one would anticipate next year, suppose we are doing some version of the public engagement, we may conclude that some things we did this year worked better than others, and therefore we try something different. We would say, well, okay, this is where we ended up last year. These are some things that we thought might be useful to do in the short term. And we did some of them, and maybe some of them worked and some of them didn't work very well. I mean, these are possibilities, right? And then what do you think? So there would be sort of continually setting new baseline and looking backwards. What did we say we were going to do? Where did we get? Where, do we need to change our idea? We thought it was a good idea, but now, the world has changed in some way. So that we're looking at it as a process, as a planning cycle, to always be looking short, medium, and long term and doing this on an annual basis.
Great, thank you. So I want to move us along to point 3 on our agenda, where we're going to have an opportunity to talk about the DDAC's response so far to this 507 request for input. Just as a general comment, the work of the DDAC really gets done via committees. We have several standing committees that meet, and they have been meeting and thinking through what recommendations they may like to make in regards to the 507 plan. So just as a reminder to all of our new members, we really would like to have everybody serving on at least one committee. So if you have not yet put your name forth for that, please be in touch with the committee chairs to do so. But with that, I'm going to turn things over to Nick, who's going to lead us through this part of the conversation.
Thanks, Michelle. So again, when we saw the 507 planning process beginning, we tasked each one of our subcommittees or our committees on the council to begin thinking about what recommendations they would want to make, and what recommendations or previous recommendations to Opwdb that they have made, they would want to make sure were incorporated into the 507 planning process. So we've asked each committee to do that. And what I'd like to do is give the committees an opportunity to report out to the council on what those recommendations are. So maybe we start, John Maltby, can I call on you with the residential committee?
Sure, Nick. So we actually had an opportunity to meet last week, and we made a couple of additional recommendations which we'd like to put to the council. For the people who are new, we circulated the previous recommendations that we've made. Those that relate to the 507 process include to make housing navigation a waiver service, to increase payment standards for the housing subsidy to at least match HUD's fair market rent, to promote rather than impede repurposing of existing certified residences, to increase funding for integrated supportive housing, to provide community education on housing options, to address institutional bias, to create the role of a super broker-led network to address the question of what happens when I'm gone, to provide benefit advisor training at quality level to fiscal intermediaries and care coordination organizations. We added to those recommendations which have been made before Two that relate to the 507. One is that Opwdb should inventory the property of the state and of the providers to enable a full picture of assets and liabilities of the overall system to be understood. In other words, we have several $billion of real estate. Can we do something with it? And the next one was to recreate Opwdb's internal strategic planning unit to provide the commissioner and staff with research and data on effectiveness of current and future housing options. The idea that a multi-billion-dollar entity with tens of thousands of employees does not have a strategic planning unit is a bit bizarre. And when we did have one, that's how we got the good 507 plans that we had in 2008 to 12. So we recommended both of those. The other aspect of it was that in the, I attended the Region 3 forum. During that, there was some description of plans Opwdb has for housing, in some to help move people back interstate from out-of-state residential schools, and those folks to go into existing state facilities, and to move the people who are in state facilities on towards supervised IRAs where there are vacancies. None of this is person-centered. None of it makes sense long-term fiscally. I'm sure the only people who would be happy would be the state unions, and perhaps some of the more desperate providers looking to fill vacancies at any cost, but the providers can't recruit DSPs to fill the vacancies that they have already. So bringing people with significantly higher behavioral needs than the people they already have in their housing, it doesn't make any sense at all. So I want to make sure that before this gets any legs, that we have a free and open discussion about why on earth would we do this, and in particular because it is so completely antithetical to person-centeredness. So that's the residential committee. Thank you.
Thanks, John. I'd like to open it up to the council if there's any comments on John's report.
The commissioner has his hand up.
Yes, Commissioner.
Thanks for the participation in the Region 3 forum and also for the work of the committee. And I appreciate what you've done. I'm going to ask you, and it's really just a general question for all of the committees, if you would be able to provide us with any estimate of current need, future need. You know, can you project what you're talking about into the future, both in terms of numbers of individuals who might require service, and also in terms of the budgetary requirements needed to support those individuals?
Yeah, I think, thank you, Commissioner. I think it would hinge a lot on the ability to repurpose some of the existing properties. I don't foresee, other than the Fmap, I don't foresee any outcome where we're going to get more money. So how can we reshuffle the existing money and take it out of some very expensive settings and put it into settings that are more appropriate for a lot of the folks? So we have a lot of people in with ISPM scores of 1, 2, and 3 who are living in supervised settings. Doesn't necessarily make a lot of sense for everybody involved. Perhaps we need to do something about supportive IRAs and to beef that up and to create other options that are non-certified. So projecting the costs would really require that we take apart some of the existing system, and projecting population, given the range of prevalence numbers and the degree of acuity across that spectrum. I think we all know that, you know, the maximum number is going to be somewhere around 450 and the minimum number is going to be around 150, but both of those exceed the number of people that we currently serve, certainly serve with any kind of residential support. So I'd be very grateful for any help if we have staff that could support us and help us, and we could clarify some of those questions. I think it would be great. And that goes to the recommendation we made about strategic planning.
And John, Commissioner, I would just interject. John, several years ago, the legislature actually had required Opwd to do a survey of need in the area of residential services. And this is just an open question, maybe to Opwd. Is that a ongoing process, or was that a one-time assessment of need.
So I can speak to that. And first of all, John, I can report that we do have a planning unit, a strategic planning unit at this point. So that's a relatively recent development. So not as a critique, but as a point of information. And that's
great news.
507 planning process at this point. We're calling it the Office of Strategic Initiatives. For whatever branding that is worth. But in terms of the housing, there are efforts underway. So we do have a certified residential opportunities protocol, which is, has people who are seeking those certified residential opportunities, to what degree are they accessing those opportunities and in what time frame. But that's information that is known. What we're working on actually as part of our current strategies is integrating all of the housing access modalities into a single administrative structure, because you want to be able to understand, as people are seeking housing supports, are they accessing if they're seeking housing, right, it's not just a certified residential opportunity that somebody may be able to access. It might be a housing voucher, it might be a supportive housing, of any number of other forms of housing supports that, that the agency funds and provides. So we're trying, from an administrative perspective, and therefore from a data perspective, to integrate all of those disparate systems into one structure, so that we can have a much better understanding of, folks' access to housing supports. Because, currently we might say, well, that person is on a list waiting for certified residential, and are they actually getting a housing voucher through a different system, through also funded by the agency? Those are the data systems that don't speak well to each other. So that's sort of a yes, and we're also working on it at the same time, to your question, right, and to John.
I think it would be great if we had a continuum of housing from ICF to self-directed, with somebody dropping in once a week sort of spectrum, and that we work towards that, and we work towards essentially a membrane, so that if somebody is self-directing but now needs more support, they can go back into, if you like, more supportive settings.
And I think, in just addressing the question that the commissioner asked, I think that we need a formal process to consistently or continuously assess need, because the need obviously changes. And whatever that process is, I know there was the legislative mandate a few years ago where I believe there was a call center invoked to actually reach out to thousands of people. And I remember actually receiving that phone call and having a conversation with somebody. But we do need a more regular, natural process to assess people's needs. Maybe it's incorporated into the annual assessments that the CCOs are required to do, but being able to take that data, because from a planning standpoint, I would think that OPWDD needs to know what the needs are for housing beyond just the CROW list. The CROW list tends to be those who are specifically seeking certified, and most likely are either in crisis or going to face a crisis. But there's a broader need out there, and to John's point, how we define that is going to basically dictate what we get.
Right. I think go ahead, Roger.
Yeah, just to throw out, I think that, and we'll get to this when we talk about the Fmap in the afternoon, but there is a significant need around the data infrastructure that underpins a number of our systems. So in this instance, the lack of data is driven by a lack of data infrastructure, and so there's an opportunity we have to improve in that area.
I was going to add the thing that Nick was referring to was the residential request list, and that was created at the request of the Assembly of the Legislature And I thought was a very well done report, to be frank. It was issued, I think, in 2015.
Yeah, and that time report with one-time funding.
Yeah.
But a consistent process of identifying need, I think, is important to the planning process, especially as we try to make it an annual process. Any other comment?
Yes, this is Margaret. I can't figure out how to get my hand up, but I would like to just go back to the more flexibility issue. Options for people who require 24-hour care are right now limited to certified, and it really shouldn't be that way. There should be many options for people who require a lot of staff time, both in certified and non-certified. And even within the certified, the supportive IRAs are too limited in their staffing allocation permissions, so that only people who are relatively independent can take advantage of that. There should be more steps within supportive employment, supportive apartments. And in terms of who gets the opportunities that come available, right now it seems that OPW is using every opportunity for their top priority, emergency priority. And people at home, it doesn't matter what their situation is. It doesn't matter if they're going to have an emergency tomorrow. They are not being given opportunities for residential placement. I think we should go back to something that worked very well years ago, which was a 50-50 arrangement, where OPW placed its priorities in 50% of opportunities, and people from the community went to the other 50%. Thank you.
Roger, would you respond to Margaret, or?
You can tell me what you'd like to do. I don't know if you'd like. I mean, we certainly. I mean, there is a CROW process in terms of identifying those who have, emergency need, and then the needs that are urgent and current. I was just struggling for the words that were the other two. And so, one of our challenges is the level of emergency need. Demand for certified residential has been significant. There's also been, really as a consequence of COVID, diminished desire on the part of the residential providers to kind of take on new residents, and it's an understandable, certainly given the challenges we've all been through in the last year. And then this is now compounded by the workforce issues that mean that I think a lot of providers have a real challenge, even if they desire to serve an individual, even if they have an open vacancy and there's a cohort that matches, et cetera. The absence of a workforce to support that the individual is a significant factor. We're hearing from a lot of our of our provider community. I mean, I think where this situates is to try to get an understanding of where is the demand coming from? Are there alternatives along the continuum of housing that can be offered? We're certainly looking into Margaret's suggestion around more kind of models or opportunities within the supportive. We are looking as part of our potential waiver actions, strengthening the supportive IRA model, and also looking at ways that that model can maybe allow for some greater flexibility for providers to invest perhaps in technology and other non-personnel supports. So I think it's all sort of on the table because we have a sort of a perfect storm of demand that's been pent up from a period of time when the system has suffered under COVID, as well as the challenges with the workforce that are making it difficult to have the level of residential. I mean, the same thing is true of other types of programming, community habilitation programming, day programming, employment programming. The workforce shortage is not unique to the residential service system. So, I mean, I get what's being said, but it's the balancing of these competing priorities given the workforce issues as a constraint that I think is really challenging us right now.
And Roger, this is Abiba. I'm not sure if you can hear me,
We can.
but I just wanted to add to that. Margaret, to your comments specifically about people living at home, we did revise the CROW designation categories where we focus specifically on circumstances. And so people living at home, or if somebody's in a hospital or an inappropriate setting, as long as their circumstances trigger an emergency need or substantial need, then those folks are sort of given, an equal look at opportunities that would be available to meet their needs. So I just want to emphasize that there's no difference between folks who are living at home versus those who may be in other settings, because we focus specifically on the circumstances. And that has been revised. That was revised maybe about 3.5 years ago, based on feedback that we received from stakeholders.
What would be helpful would be if we had access to the data, that word again, on the number of people placed from home versus number of people placed from the Opwdb emergency list. There's another obstacle too, I believe, and that is that when you have somebody with high needs and you are trying to place them from your Opwdb list, I understand that the funding is not offered at an appropriate level many times, so that providers are loath to take people that they don't feel that they can afford to support adequately.
I can speak briefly, and I do, Nick, want to give Nick and Michele the opportunity to have other, but we are also currently working on potential reforms to our rate setting methodology for residential services. That's something that we sort of began the process, prior to the current 507 planning process, but will certainly be informed by it. The core idea there is that we would be moving towards regional fees. So right now, as folks may be aware, we pay for certified residential on an agency basis. There's an agency rate which is cost based. So that's looking at historical costs of that particular agency. What we would be moving towards is a regional fee with an acuity adjustment upwards or downwards, depending upon the level of acuity individuals served. The idea being there that as a new person would come into a provider's care, who may be somebody who's more needy and therefore would require more staff to support them, there would be a predictability. Okay, I know that I'm going to be reimbursed at a level that's appropriate in a way that's timely, and that's independent, to your point, Margaret, of any of the, where did that person come? Where did that person live immediately prior to entering into this particular setting is not going to be relevant. It's really the relevant acuity of the person. The downside, because there's always a pro and a con to everything, right, is that those providers who might find themselves serving individuals who are of a lower acuity would have a rate that would be less than those that are serving somebody with individuals who have higher acuity. But that's the way so we would be at that point sunsetting the higher needs methodology and instead using this methodology, which we think would be more timely and more achieve the objectives of serving individuals all across the spectrum of need.
All right, Roger, thank you. I think
just one last word, if I could, Nick.
Okay, John.
Just one last word. Roger, if you can connect me with the Office of Strategic Initiatives, then I'm sure that the committee members would be very glad to work with them and see what we can come up with.
Okay. So
thank you.
I know we have a couple of other comments here, and I want to make sure we give time for the other committees to report their recommendations. And I also want to advance what John just said to the General Counsel for kind of a an acceptance or vote of recommendation to move those forward to OPWDD. But we had two hands up. Meyer, you had your hand up?
Yes. Are you hearing me?
Yes.
First, family care is not mentioned anywhere as an option, which is also an option. It's a physical, very attractive type of residential placement. Secondly, shared living is something that other states has explored, and New York State was working on it. And I think it's a very attractive and family-oriented type of residential placement. Thirdly, there is many vacancies in state-up residence. And the fact is, it's not being filled for quite a while. I think those vacancies can easily be filled by volunteer agencies. So those vacancies, which is for quite a while vacant and not filled, should be moved to the agencies, volunteer agencies, community agencies. So there is no new allocations. It's just an allocation that is floating around for a long time, can be can satisfy a lot of people.
Thanks, Meyer. I appreciate that. Dan?
I wanted to hypothesize or have us think about the concept of the new funding method helping with the high needs population. First off, I want to start by saying that the new funding methodology that OPWDD is working through is in fact the right direction. We need regional acuity adjusted rates. But I hypothesize in this DSP workforce shortage world that getting additional money to support one particular individual, which will be important, will not be enough to overcome the amount of money that a particular organization would need to pay all of its staff more money in order to be able to actually attract staff to work. And so we can't pay the staff that are supporting the more high needs person more money than we're paying the rest of our staff. So I worry whether that's actually achievable or not with this new methodology, which is not to say we shouldn't go to the new methodology. We're just not sure in today's world it'll meet the objective of global will.
Thanks, Dan. All right, what I'd like to do is just ask the
Nick, this is Josie.
Yes.
Stephanie just wanted to make one comment. She wants to say they need better transportation for people with disabilities and also more group homes.
Okay, thank you.
Nick, and this is Ted. I do have my hand up, but I did want to stop before you take a formal action and offer a comment that's informed by my prior experience as a member of the DD Planning Council, where I was a member for about 4 years. And at the time I was brought onto the council, one of the first issues that we addressed were related to conflict of interest. All of the members of the DD Planning Council, because they were making recommendations about funding, appropriations, and other issues, had to comply with a conflict of interest policy. I think that before this body moves forward on making recommendations, that policy for the DDAC be reviewed and agreed upon, and that we can not taint in any way the work of the committee in terms of what is moved forward. So I would encourage that at some point, preferably before the council took any action through a vote or moving anything forward.
Okay. And I know we have had, in fact, I know we asked about this when we had the appointment of new members, whether or not we were going to get a new JCOPE presentation for the members. So maybe we defer any action and we put that on as a priority, and would look for OPWDD to guide us through that process.
Nick, this is Roger. I can certainly facilitate whatever we need to do there, Commissioner, as well. I can't say that I know what exactly the process is, but we can find out with our team and make sure that we follow the right processes there.
Yeah, and I just want to jump in on this because it's a little bit of a curveball for us. We definitely want to make sure that the DDAC is able to weigh in, though, as you're developing the 507 plan, which needs to be submitted by November 1st. So we'll need to move that process, whatever it is that we need to discuss in regards to conflict policies and be informed and educated on. We're just going to need to move that along quickly so that the DDAC doesn't lose its opportunity to weigh in.
Absolutely. I'm sure we can measure the amount of time in weeks. So I'm pretty confident of that, and then we may need to schedule a specific training or whatever we need to do in order to do that. But I know there's an answer. I just don't happen to have it at the ready. So I'm not venturing it until I have an opportunity to talk to our council and just make sure that we're doing it the right way.
Yeah, we would look for your guidance on that. And like I said, in the past, they have given us a J-code presentation. I think for the purpose,
it's a good flag and what's something we want to do it the right way.
Right. So for the purposes of today's session, I think we can let each committee report what things are, and then after we go through that process, we will then vote for enhancement of those recommendations. Does that make sense? I think we would add, John, I would just add to your recommendations a couple of the things that were brought up. Obviously, as part of a robust planning process, we're going to need the agency to do a needs assessment and quantify the cost of meeting those needs. I think there was a discussion about continuum of services and a couple of other comments that we've recorded. So we'll make sure we add those to your recommendations from the residential committee. Can we move to family support services, Margaret?
Yes, I'll try to be very brief. We testified last night I testified last night on behalf of the full Family Support Services Committee. Some of these recommendations are in addition to the ones that have previously been submitted to the Developmental Disabilities Advisory Council, but most of them are the same. New was we wanted an increase in the funding for OPWDB services, which is actually a no-brainer. You can't serve more people with the same amount of money, the same flat amount of money, without depriving some people. And we wanted an increase in family support services in view of the fact, especially that there's, we can call it a slowdown in residential placements, even for people who are on the cliff of desperation. So we needed services to support those families. We talked about the workforce shortage, which I don't have to rehearse here. We talked about equity of access for people with high complex medical and behavioral needs who are often excluded from family support funded programs because the funding is not adequate. We talked about partnership with families, spending decisions regarding family support programs, increases, reductions, and reallocations should be done in collaboration with the local councils who are really the experts at the local level. We asked for data to be shared on utilization of family support services. We talked about personal choice and flexibility of services. One example, maintain both virtual and in-person options for the appropriate services to meet individual preferences, and to maintain some family support funded service coordination in addition to the CCOs for people who are not eligible for waiver and for people who really don't desire any waiver services at that present time. We talked about encourage care coordination organizations to develop expertise in specialty areas such as mental health and substance abuse, expedite central office review of self-direction budgets, which seems to be where there's a significant delay, and develops consistent guidance for family reimbursement programs, a process that's been underway at OPW for quite a number of years, and as we heard yesterday, close to completion, and develop guidance for self-directing individuals as to which family support funded services they may use. And then we talked about the uncertainty that families are feeling, not knowing what direction regarding managed care the agency is moving in, and families are afraid for their future. So that's a quick summary.
Thanks, Margaret. Any input, comments from the council? Okay. All right. Thank you, Margaret. Can I go to the system subcommittee, Dolores and Michelle?
Yes, hi. I'd like the other members of the committee to jump in at some point if they would like. So we looked at 4 different areas, beginning with how do we meet the growing demand for services. And I just want to read our opening statement because I think it's important. All planning should start with the individual and whatever is the most natural, closest, most consistent, and likely to endure over time as a support system or circle of support. That's usually the family in one form or another. OPWDD must recognize the important role of families and caregivers in stabilizing this system of care and prioritize family support. Okay, so we also made a statement that people need to get the right supports at the right time, so that requires flexibility and innovation. And we're opposed to systems change that is affected through budget cuts without meaningful engagement or a clear path forward regarding how people will be served and safe in emerging systems. We feel that, we all have a shared goal for the people that we support, and we want them to have a good quality of life. So we should be able to work together. We really want OPWDD to work with its advisory councils, the task forces, self-advocates, families, providers, service and care management providers, and all the stakeholder groups to ensure that there is a mutually accepted understanding of the needs of people supported, a shared philosophy, and what does OPWDD strive to be? I think that we need some real rich discussions around this. We think that. Historically, real conversations about systems redesign, though, have been missing. And that runs the risk of fixing things that are not the central problem. So real conversations have to involve listening rather than a one-way dialogue. So we really need OPWDD to listen and learn so that there can be true collaboration. We also need to define quality and how it's measured. Okay, quality of life is different from regulatory compliance. So this can only happen really through data-driven decision-making and revised funding methodologies. So we have the following recommendations. Prioritize family support services, supports to self-advocates, and supportive decision-making. Address concerns raised about the validity of the CAS, the accuracy of information recorded, and the lack of transparency. Utilize the DDAC to the full extent of its role and authority. Provide transparent and complete information about policy priorities within the agency, allowing adequate time for stakeholders to shape those policies. Provide timely, relevant, and meaningful data to show what's working and what's not. Ensure that there's space for innovation. by not focusing conversations exclusively around existing services and support. Establish a cohesive connection between the needs assessment, data, services, supports, funding, rate setting, and other services. Advocate for reinvestment of any dollars saved to support innovation and creation of a service system of tomorrow based on the data. Develop a methodology to project increased use of services, resulting budget impacts, and communication of data. There's that word again, regarding such to inform systems planning. Okay, and then we went on to look at how OPWDD can work with other state agencies to plan for children and adults with complex needs. So we said up front, complexity is an expectation, not an exception. Okay, so while most OPWDD eligible people will require lifelong support through the agency, we're also going to require access to other state agency services, such as behavioral health, health and dental care, education, probation, foster care, homeless housing. So we really want OPWDD to assess how well it works with those other entities. So we want OPW to listen and learn from advisory councils and other stakeholders to identify gaps, conflicting regulations, and barriers. We want it to assess its relationship to the other state agencies and local government and look to develop true partnerships. We want OPWDD to stop viewing its mission, services, supports, regulations as oriented toward adults in certified settings and begin to function as an adults and child serving agency, recognizing community support needs. And finally, under this topic, address the need for a continuum of preventive inpatient stabilization and crisis support for kids and adults. The third area we looked at was under diversity, equity, and inclusion. So we said OPW should engage in an assessment of these important values within the DD system, both internally and externally, and then demonstrate its commitment to the people supported, their families, and the workforce to develop meaningful, actionable, impactful policies and strategies to improve supporting all of these stakeholders. And then we also talked about the need to translate, make a commitment to translate and post all minutes and slides from public meetings in sign and other languages, which it is doing, so that's commendable. Under communication and transparency, the pandemic highlighted the need for significant improvement of communication with stakeholders. So OPWDD should assess and evolve multifaceted communication strategies with all its stakeholders, ensure consistent messaging from all levels within the agency, provide information that's accurate, transparent, and communicated in a way that's understandable to all stakeholders. Post minutes of all public meetings in a timely manner, summarize topics discussed and agreed upon actions and next steps. And then finally, we just wanted to mention that we have made a number of recommendations in several other areas over the past couple of years, mainly on the front door. And we put together a paper on reflections on 2020 to name 2 of those recommendations. So we hope that OPWDD will look at all of those recommendations that we have submitted in the past and respond.
Thank you, Dolores. Dolores, what I would suggest is that the recommendations you just made, along with those previous recommendations, what we would do is we'll consolidate those with the other subcommittee or committee recommendations. And then after we go through the process of JCOPE and conflict of interest, we will vote on them in their entirety and then submit.
Sounds good.
Okay, thank you.
Comments? from the committee members or anyone else?
Thank you, Dolores. You did a great job with the summary.
Yes. Great. Thank you, Dolores.
Just Ted again, I do have a question, maybe it's a comment, and I think I heard you say that OPWDD should prioritize funding to family support services, self-advocacy, and supported decision-making. And I don't want to have a debate or really do more than to highlight that and make an assumption that there may be a recommendation from another subcommittee or committee that might conflict with that prioritization, and ask that the DDAC try to integrate and coordinate the recommendations of the committees so that there's less conflict internally. If, for example, the housing committee said there should be a prioritization in housing, or some other group said there should be a prioritization around self-direction, you know, how can that be used by OPWDD to support the recommendations of the DDAC? So not to work this out now, but to really point out that if there's internal inconsistency within the recommendations of the separate committees, that's going to create some impediment to OPWDD acting on behalf of those recommendations.
Respectfully, Commissioner, people are multifaceted, you know, and there isn't, you know, a one size fits all that, you know, let's put all of our prioritization eggs into this one basket and that will serve the diversity of people that we have. So I think that, you know, we face the same struggle that I know that you face internally as well, in terms of figuring out that there are limited resources and how do we best utilize them. And I'm sure we will take that comment and feedback back and work with it, but we may find it as troublesome as you do in terms of deciding which priority is, you know, the chief one, because this is an individualized system that's person-centered, that's hopefully trying to meet needs in an innovative way, which means it can't be one size fits all.
No, I appreciate the dialogue, and really this is helpful and constructive. I can just recall back to December, January, and February when we're looking at vaccine access and vaccine prioritization. You know, first the IDD folks were 1A, and then it seemed that 1A kind of expanded dramatically to incorporate first responders, healthcare workers, essential workers, and suddenly it seemed that everyone was a priority for vaccine access. And what that meant was that no one was a priority for vaccine access. It was pretty much everyone had access to it. And we lost the ability to specifically target folks with IDD and get access to the vaccine. I don't want to see the same thing happen where everything's a priority and we can't really move forward. So I appreciate the dialogue. It's all intended in good faith. We want to be able to use what you're telling us in a constructive way. So
yeah,
any internal conflicts would be helpful if they were eliminated.
Yeah, this is Donna. I just want to follow. I'm sorry I can't raise my hand, so I just have to speak. But I think really maybe I agree. We have to kind of pull this all together as a cohesive whole. And I think though the under the umbrella, well, the systems subcommittee kind of looking at the systems to support many of the other activities of the other committees as well, right? And how does the system create the right condition? But the common theme I think is more options. And so if we maybe prioritization is maybe that suggests priority over something else, but I think what we're all saying in sync is really having more options and then looking at real need to see, you know, who would take advantage, where is the need, what do people want to be, what do families and individuals want, and sort of try to align then the resources toward that way. And even going back to the subcommittee on housing, is sort of really understanding the need, and how do we then begin to advance different ways of looking at housing supports that meet more person-centered needs, where a person really doesn't have to move around if their needs change. So I think there may be a way to reframe that in a way that doesn't suggest one is over the other one, I guess is all I'm saying.
It's John. Can I have a question, Nick? Yep. You mentioned, Dolores, you mentioned the supported decision making. Is there any activity underway? And this is, I don't know the answer to this question. Is there any activity within WDD liaising with either, I don't know, the surrogate system or other to find ways to promote supported decision making or to incorporate it into practice and to get away from the binary nature of Article 17A guardianship?
Sure, and I do want to respect that we have a lunch break that we built into the agenda, but there is a bill that is an OPWDD departmental bill that has been introduced and actually passed the Senate, I believe, I want to say Monday, but I might be wrong, it was earlier this week, that would create the legal infrastructure for supported decision making to be available to individuals. That was an important next step for us in terms of the accessibility of the supported decision making program more globally. I believe it is being considered by the Assembly, though obviously I don't speak for that branch of government, there isn't a whole lot left in terms of days of session, but that has been our focus, which is that a piece of legislation that would allow for the recognition of duly negotiated supported decision-making agreements. Nick, if I could throw it back to you, I think perhaps, I don't know, you want to try to wind this up and say in the agenda?
We have some, I want to quickly, because I know we've got some limited time here. We've got a couple of things to cover. Gary, I don't want to short you, but maybe you can give us some quick highlights of the Health Subcommittee, and then we're obviously going to have to reconvene and bring these back anyway for a more formal submission, but do you want to give us the highlights?
Yeah, I can be very quick. And Dolores is going to give the update on the Complex Behavioral Subcommittee. So Dolores, if you could get that in a paragraph or a sentence so we can include that. But our mission is to examine the equity, effectiveness, efficiency of medical, behavioral, and dental services for New Yorkers with intellectual disabilities in order to make recommendations for meaningful improvement in overall health, stressing the importance of providing those in integrated settings. We've had recommendation number one. We've had a dental task force. We believe that dental task force has done a terrific job over the years. We think it's a best practice in public-private cooperation and has been able to have a lot of great programs that have helped people. We want to see continued support. We don't take it for granted that you'll have support, and one of the recommendations is for continued support. Recommendation number two, in the same vein, we'd like to start a medical task force, which we've just started, and have similar efforts to support. When we talk about support, and I know dollars are an issue, there's really no dollars involved here, or very minimal. It could be some dollars if we need to use a room at ODHAC or we ask for video conference time, but the return on investment is just incredibly high. Everything we've done, we get some grants from DDPC for programs now and then, and we're looking for support in a comparable way for a medical side. We would like to see a post-COVID analysis of the health and safety of individuals with IDD, the entire crisis, in order to include but not limited to topics such as PPE, testing, vaccination. I believe, and I suspect you're already doing that, but we think that it should be out there so that we learn from the lessons of the past so that improvements can be made in the future. And Commissioner, you just mentioned one about the priority issue, and I appreciate that. That's right. We also would like to see expansion of medical, dental, and behavioral telehealth, and I believe that's something that's also being done. But not knowing exactly what's being done, we're mentioning that. And the last recommendation is for our committee's complex behavioral subcommittee. Dolores, can you just provide a paragraph summary on that?
Oh, that will be very difficult to do.
I know.
So, go ahead. So we are a subcommittee of the Health and Wellness Committee, looking at complex behavioral needs. So, and those are broad. Working definition includes behavior that significantly interferes with daily routines, learning, and socialization, and behavior that put the person and or others at risk of harm, at risk of out-of-home placement, or necessitate a higher level of care. So that's our working definition. It includes people with behavioral health diagnoses, but others as well. Okay, so we started out identifying the most fundamental problem that we have is finger pointing between the 3 state offices, OPW, OMH, and OASIS, and it leaves kids and adults with co-occurring needs and families caught in the middle. So behavioral health providers sometimes hold antiquated beliefs about people living with a developmental disability, their strengths and capabilities, and how they live their lives. And they can unintentionally put them in a box as if they're all the same. It's not uncommon for a psychiatrist or other behavioral health clinician to attribute presenting problem behavior to the disability. They may refuse to acknowledge that it could be a symptom of an underlying behavioral health condition. And then in a hospital setting, they medicate to calm the person down and send them home. And it becomes a revolving door within a single day or over days. So we really looked at that issue, and we made the case that it's generally accepted that drastic changes in mood, self-harm, extreme sadness, anxiety are symptoms to be treated. But when the person living with a developmental disability presents with the same behaviors or symptoms, they're considered behaviors to be managed, not treated. And to this day in 2021, we point out that we're still hearing common statements like, oh, it's just behavioral, it's part of the diagnosis, you need to build a better behavior plan, and even they're just retarded. This is what we hear in 2021. So we're affirming that symptoms are behaviors, behaviors may be symptoms of behavioral health concerns, and behaviors may be learned. So either way, regardless, services and supports have to be available to rule out and address any factors that contribute to behavioral challenges. Okay, so we made some specific recommendations around what the 3 state agencies should do, and then some specific to OPW.
Great. So Dolores, are those going to be incorporated, Gary, in the health recommendations? Yes. Okay, great. Okay, thank you. In the interest of time, again, I'm going to move us along a little bit because I know we're kind of on the break and we have to start again at 1 o'clock. What we will do is we'll work with the agency, Roger and Josie, to schedule the JCOPE and ensure that we abide by any conflict of interest rules or policies. And then we will ask the subcommittee or the committee chairs, I keep saying subcommittee, the committee chairs, to incorporate the recommendations. As a group, we will prioritize them to ensure there's no conflict. And then we will call a meeting to have the council approve them so that we can advance them as part of the overall DDAC planning or the 507 planning process. Does that make sense?
Yes.
Okay, great. We have just 2 other issues that I'd like to just get to. One is we have a responsibility as part of our charter to review proposed regulations. What we discussed is, we talked about this in executive committee, that you know, we would like to be able to receive those as far in advance as we can. That would be a request to OPWDD. If we could get a calendar of when regulations will be coming out and what the comment period timelines are, that would be helpful for us to then decide whether or not those the review of that regulation should be taken up by the council, or whether or not we would pass, whether or not it should be deferred to a committee or discussed as part of the council. So that would be our request. Just want to inform council and that request.
Yeah, no, I think we do either do have or can provide, you know, within the limits of some predictability. There are regulations, for example, that we put out last year that were emergency regulations to deal with COVID. So obviously that, you know, there's planful activity and then there's crisis response normally. And so we can provide whatever advance, you know, in notice. I would point out also that I did share with the DDAC. There have been a couple of bills that have passed the legislature this year that seek to impact DDAC operations. And so, you know, you could also choose or not choose as you see fit to provide commentary, you know, and we can certainly provide you the framework for how one provides commentary on legislation and to make a recommendation regarding signature or not on those. So and then we would also be so yeah, we can certainly facilitate a process to help meet that responsibility of comment.
Thank you, Roger. And then secondly, there was a bill that passed both houses giving the DDAC the responsibility of writing a report on COVID response. Just quickly read it. It's basically requiring the DDAC to produce a report evaluating the state's response to COVID-19 state disaster emergency as it relates to individuals with IPD. And we have to decide as a DDAC whether or not we would want to encourage the governor to either sign the bill as approved by the two houses or veto it. You know, we can send, I think we just received it this morning. I will send a copy of it to all the members. And then we could poll you as to whether or not we would want to make that recommendation one way or the other. Does that make sense? Is that okay? I know none of you have seen it, or probably none of you have seen it, so we'll make sure you get a copy of it. Okay. All right, with that,
Nick, this is Ted. I have one question. I have not seen that bill. Do you know if it includes an appropriation to fund your work if you were be responsible for that deliverable?
Well, Commissioner, I just received a copy this morning from Roger, so Michele and I just received it, so I haven't even had a chance to really read it.
Yeah, I think it passed the legislature yesterday, so it's recent in that way. So I just shared it with you as a point of information, and you know, certainly we're analyzing the bill ourselves. For, you know, OPWDD will often make internal facing recommendations as to whether or not, you know, a bill is useful or less useful from that perspective. So so I thought there is one other bill, Nick, that I've shared with you all, which once again you can choose to comment on or not. There's a bill that seeks to modify the composition of the DDAC and change some responsibilities. So once again, you know, I would regard DDAC's views on this to be sort of independent. OPWDD's views may be different from, and we can certainly provide you. There's a way to submit comments into the, you know, independent of OPWDD if you choose to do so, because as a body you may have a view that is, you know, is different from or similar to the view that OPWDD as the state agency might have. But as we see bills that may have a direct impact on your operations as an advisory committee, I'm just flagging them for you for whatever actions you all may see.
No, we appreciate that, and again, this was new to us, so we will both.
Yeah.
with the council and then reconvene. All right. We are going to take a lunch break, and then now it's a 15-minute lunch break, and we will start again at 1 o'clock. Thank you.
Thanks, Nick.
Discussion.
That's correct. Yes.
Wonderful. Shall we get going again for our afternoon, having had a brief break?
Sure. I just want to make sure we will need Josie to help us when we get to the public comment period. So is she back in here?
Yeah.
I am here. When we get to that period, people can raise their hand, and then I will call on them and tell them that they're unmuted to speak.
Wonderful, thank you. Okay, so we'll get restarted. Seeing every minute is valuable, and we always have lots to discuss. So thank you everybody for being patient with us with the 15-minute lunch. We hope you're being patient with us. We did have some feedback after the last meeting about the introduction of the DDAC, particularly with as many new members. So we did want to take a little bit of time, but it was about 15 minutes that put us about 15 minutes off on our agenda. So apologies on that. Just a couple of quick housekeeping notes, because what Nick was just sharing in regards to us considering the DDAC's role in regulatory oversight and this new legislation that may create a pathway for the DDAC to actually be legislatively mandated to provide a written report on COVID, really highlights what I mentioned quickly in the first half of the meeting was the importance of our members joining committees, and getting involved, because that is the place where we're able to really drive this work forward. If we do move with supporting a bill that requires us to write a report on COVID, and if we are tasked with that ultimately, we're definitely going to need some of our members to step forward to assist with that. So we want people to be thinking about it. Nick and I quickly looked at it this morning. Our understanding is that we have 9 months to do that report, so that if that goes forward, there would be time to do it effectively, but please be thinking along those lines. One last administrative note. The other request that we've had internally from our members is, some sort of directory beyond just an email distribution list. And I want to give thanks to Samantra, who's been helping me out a little behind the scenes with a way to most effectively do that, where we can capture the information. So please be on the lookout for that, so that we can gather that information from each of the members. It will basically be what you gave in your introductions this morning. We're not looking for a lot of detailed information, but we appreciate that. So thanks everyone for your comments and work this morning on the 507 process. As I've spoken to many members about when we were excitedly looking to welcome you, we had no idea that we would be as busy as we are with 507 and now this Fmap opportunity. So for the last hour of our meeting, we wanted to devote it to a conversation about Fmap, and we want to leave plenty of time for public comment on that as well. But I'm going to kick off by handing it back to, I presume, Roger, who's going to give us a bit of an overview in regards to exactly what this Fmap opportunity is about and where the state is in their planning in regards to this. So Roger?
Well, thank you very much. So first of all, so we can do acronyms. That's Fmap is about the federal matching funds that are available to states that operate Medicaid programs. So the typical match is that where we are a state that has a 50-50 match. So we spend $1 and that earns $1 federally. And so the vast majority of the services funded through Opwdb are Medicaid services. And so the state effort in terms of expenditure is doubled through that federal match. One of the ways when the federal government would like to stimulate additional spending on programs that it can do so is by adjusting the federal match. It did that as part of its COVID response, and more recently it is doing that in the American Rescue Plan, which was the federal law that passed in mid-March. And what that law did is it said that for states from April 1, 2021 to March 31, 2022, which just coincidentally happens to be New York State's fiscal year. It's not every state's fiscal year, but it is ours. That the state will earn an enhanced Fmap, so an additional 10%. And what that means, also in that statute, it said that that there needs to be a supplement, not supplant requirement on the state. So the state would generically maintain its current spending and would realize extra federal revenue. So as I said, this was enacted I think it was March 15th or thereabouts, right, mid-March. It came into place right as the state budget was closing down. So we have a state budget deadline of April 1 each year. In the New York State budget, there is appropriation to support this program, appropriations to the Department of Health, appropriations to Opwd, also OMH, OASIS, OCFS, probably a couple other agencies that I'm not currently mentioning. And these are all agencies that have a relationship to home and community-based services, Medicaid's funding. So the principle that was established in the budget was that each agency's spending that was earning this additional federal match would be reinvested in services and supports to support that particular agency's mission. So if you look at the budget bill in the appropriations, if you're motivated to do so, you will find appropriations for each of the state agencies. Opwdd has, I believe, $740 million as an appropriation. And to be clear, that is the authority to spend up to that amount. It is not the equivalent to cash. The issue being it's a 10% enhanced Fmap against services that are rendered in this state fiscal year. So it's a projection of a potential value, not an actual value, because we've only lived through 2 months of this state fiscal year plus a few days. We, as mentioned at the beginning of this meeting, launched a public process around 507 planning in mid-May. In that same document, we were asking for ideas and submissions regarding the enhanced Fmap, how that money may be used. And to be clear here, this is one-time revenues to the state, not recurring revenues. So there's a challenge about how do you spend money in a way that is not likely to generate significant out-year expense. Literally the next day after issuing the invitation for comment, that's when the guidance from CMS issued. And the guidance I mentioned earlier, our strategic planning webpage, we've posted the guidance there for ease of reference. It's also available, on federal websites as well. And the requirement that CMS had in that guidance is that states would A, engage in stakeholder engagement, which was certainly our intent anyway, and B, that a plan ought to be submitted to CMS within 30 days. And subsequently, verbally, I'm not sure by virtue of a written guidance, CMS has made clear that states could take up to an additional 30 days. So under the original guidance, that plan would be due on the 12th of June, 3 days from now. That's certainly not, I think, what's going to happen at this point. So, you know, there's some tension for us as well as our sister agencies in both wanting to have a robust engagement with our various stakeholders, as well as obviously needing to meet the requirements on a federal level to, you know, to submit a plan. So we are certainly receiving comment from a variety of stakeholders and looking to put together at least the outlines of a plan in the sense of, you know, what are the major areas where we think it would be invested. There are, I would say, a couple of large questions that we're still seeking clarification on federally, one of which is what, you know, what is spending? So if we are spending by reserving monies for particular purposes, is that something that could be constituted as obligated? And, you know, that would allow one to spend the money out over a longer period of time versus, you know, different other forms of spending that might put a lot of cash out more immediately, but then would raise the concerns about how strategic are you with regard to the use of the funds. And then the other piece of it that I would flag for this committee is in the guidance, it was clear that there needs to be a federal mechanism, of an approved mechanism for spending the money. For us in the Opwdb system, that would require a waiver amendment, either an emergency waiver amendment through an Appendix K or a permanent waiver amendment. Now, you know, the emergency waiver happens more quickly, but has greater limitations on its what can be included in it. So the mechanism of spending is influential in terms of the strategy we might want to pursue here. So that's sort of where we are. So we're both trying to work out the what in terms of what are the priorities, as well as the how. You know, how does the money get delivered to the places where you want it to go? And I think that's a fair summary, Michele, unless there's something you'd like me to add to that.
No, I don't believe so. That sounds good. So just in terms of where we are with the DDAC's response, and certainly we want to be able to weigh in thoughtfully in regards to this, and are struggling the same as you with the, you know, the way that, you know, when this was released and the timeline of it, and as I said, was released just as we were welcoming in all these new members. We have had some conversation internally at the committee level in regards to what might be our recommendations in regards to how Fmap monies may be spent. But to, you know, the commissioner's earlier report, I wouldn't say that we've had an opportunity to formalize those comments and really kind of make sure that they're coming together in an integrated way for the purposes of, you know, transparency with the public. Some of the ideas, you know, that have been being discussed, and you'll hear some themes from our 507 planning recommendations. Include that, you know, this is an opportunity to invest in the data structure, the infrastructure that we have around data. We keep hearing over and over, and I heard it at some of the stakeholder forums as well, that there just is not enough high quality, relevant data to inform the decision-making process. We've talked a little bit about needing to have a plan for the plan. How do we get to strategic planning in a way that we make sure that we know where we're trying to go, we know what our goal is, and we're not just putting together kind of a hodgepodge hodgepodge of list of ideas and needs. So would an investment in you know, some type of facilitation around that strategic planning make sense? The commissioner, you know, today, you know, was you know, mentioning in regards to the housing recommendations, you know, needing more information about, you know, what's the anticipated need? How many people do we think need to be served? What should be the budgeting needs around that? If we don't know those answers, and, you know, I would suggest that, you know, we don't think that the DDAC, I believe, would want to be part of those conversations, you know, bring something to bear to the table in regards to those conversations, but we don't think that ultimately the DDAC would have a responsibility for being able to do those types of projections. But if that's a need, maybe an investment needs to be made in terms of that, being able to determine needs and do that future planning. We've talked about, you know, the continuum of housing opportunities, being able to be innovative in regards to that, making investments in infrastructure and technology to invest in that potential innovation in that area. Most definitely staffing has come up, but we have not agreed internally in terms of what might make sense in terms of a recommendation in regards to staffing, very specifically to some of the challenges you were just talking about, Roger, that, you know, if you use this money to raise, you know, salary levels or, you know, rates of pay, how does that become sustainable when this one-time investment goes away? But on the other hand, could there be some you know, ways to address the you know, staffing crisis that we know that we're in right now, in terms of incentives, in terms of maybe investments in raising awareness of DSPs as a profession, you know, working with the schools and VOCEs in regards to that. Can we get creative in terms of that? Last one I'll mention, as I said, this is not an all-inclusive list, but crisis supports, you know, and meeting the needs of people who have very high complexity, meeting the needs of people who are in crisis. How might this, you know, these dollars be used for that? So those are some of the conversations that are happening currently within the DDAC. I do want to give an opportunity to any of our, particularly our committee chairpersons, and then anyone else who is a member of the DDAC. If there's something I've forgotten from that summary, I want to give an opportunity for people to have an opportunity to weigh in on that. And then once we do that, we'd like to really devote the rest of the meeting to be able to hear from the public, because we certainly, as the DDAC, want to be informed by the public and their priorities in regards to both this Fmap opportunity and the 507 planning process overall. So do any of our committee chairs have any comments? Is there anything that I neglected to mention in terms of some of the conversations we've been having? No?
I think you covered it.
All right, thanks, Dolores. Any of our DDAC members have any comments? Okay, so as I said, we'll turn over to do our public comment portion of the meeting. We have until 2 o'clock for that piece of it. Josie is going to help facilitate that for us. We do have currently at the moment 205 people on the call with us. We certainly want to be able to hear from as many people as possible who would like to speak. So we are going to use the 3-minute timer that people who have been going to the forums are familiar with. Again, we really appreciate and want, on behalf of both Nick and myself, want to extend our appreciation to the interest of the public in these meetings, and we want to make sure that we're providing a means for you to be heard, and we truly appreciate your voice in allowing us as members of the DDAC to really fully consider the opportunities and your thoughts as we make recommendations. We recognize that this is serious work that we're engaged in at the DDAC, and we want to be responsive to that and make sure that we are being responsive to your feedback. So I will turn over to Josie.
Okay, the first person we have is Clifford Himowitz. Clifford, you're unmuted. You can begin speaking.
So thank you for the opportunity to listen in on your meeting. My name is Cliff Himowitz. I'm from the Long Island region, and I'm a head injury survivor. I haven't heard any mention about any subcommittees that addresses traumatic brain injuries. I'm a member of the Traumatic Brain Injury Service Coordinating Council, and I really think there needs to be some more communication between the two, because I believe that the people with TBI that receive certain Opwdb are a different population, and we want to ensure that they're receiving all the assistance they need to address their head injury concerns, as well as all the other concerns that are offered. Is there a committee or a subcommittee that addresses traumatic brain injuries in your DDAC?
Hi, Clifford. I'll answer that one because it's an easy one, but I don't want to set up a precedent that we'll be able to answer all questions.
Okay.
We really want to hear from the public and be able to take that back. And I don't want to speak on behalf of Nick and the entire DDAC. That would not be fair, but that yours is an easy yes or no. We do not have a specific committee that addresses head injury, but as you've heard, we do have a health committee that looks into health needs of individuals with developmental disabilities.
Okay, so I'd like to make a recommendation to the health committee to address the issue of people with traumatic brain injuries. Thank you very much for my time to speak.
Thank you for your feedback and input. We appreciate it.
Next, we have Sarah. Sarah, you're unmuted. You can speak.
Good afternoon, everybody. Thank you. I'm not on the council, but I find all these issues very interesting. I just wanted to speak firstly about the data, which Michele just mentioned as being a priority for the council. And also Roger, I believe, said the same thing. You want to improve the data infrastructure. I think it's really important that we start to see an accountability for data on the Opwd communication channels on the website in order that we can monitor the progress on some of these issues. When the funding starts getting spent, we want to see results with the housing waiting lists, and we want to be able to see what's happening with the numbers. And so building a broad data infrastructure is very important, I think, for the committee. Secondly, as regards prioritization, yes, of course, it's really hard knowing what to do with the funding. Firstly, I think Opwdd obviously owns the decision from the perspective of the spending and prioritization, but I find it very, very heartening that these councils are in process and are getting the feedback. So I think it's very heartening. I love the forums. Thank you very much for that. But Opwdd owns the duty of care to the population, if you like. And as far as I know, ICF care is still a Medicaid entitlement. I don't think there's been any change around that. I'd like to see if there's any tension between the timescale for the federal accountability for the plan and the desire to and the obligation to work with DDAC, then I would say then let's look for common denominators. And the common denominator I see out there is the direct support workforce, which touches on literally everybody, whichever part of the continuum you are. If you want to access your community and have freedoms, then the direct support profession is what we need to build on, the creative ways that Michele mentioned, but that should absolutely be the priority. It's ironic, I received a notice about $400,000 available for funding and training on equity and diversity and inclusion and gender identity, and this is all laudable. But if we don't have a direct support professional who can take a person to express their identity at a pride parade or whatever, then the rest of it won't matter. Let's do first things first. Take care of this workforce, value them, build on it. That would be my feedback. And then lastly, just wanting assurances really from Opwdd that there's nothing in these bills that would diminish the role of the DDAC. Perhaps you can bring that before you close the bills before the legislature just now. And secondly, how can we, as your population and their representatives, empower Opwdd to ring fence this incoming funding? for the population. I read these stories about being swallowed up in general funds. Can OPWDD help us know and be reassured that this money won't go elsewhere, that it really will be allocated to our population? Thank you very much.
Thank you, Sarah. Appreciate the comments. The legislation that's out there is all relatively new, so I don't want to speak on it definitively. I know that some of it addresses the way that members are appointed and by who those members are appointed. I'm not aware of anything that has me concerned about the role being diminished through any of the legislation, but we will be looking in more detail at that.
Next, we have Edward. Edward, you're unmuted.
Okay. Can you hear me? Good. Okay.
Yes, we can.
Okay. My name is Edward Eisman. My wife and I are advocates for over 40 years. We have a disabled daughter with Down syndrome, and she is a wonderful, lovely lady and works to be independent. She lives in a residence. We've been involved all the years since she's been born. She was a few weeks old. We went to the first parents meeting with some friends who we made lifelong friends, families. Over the years through school, we've always been involved, and we had a lot of feedback from other parents and teachers. And that was very important in directing us to make the best decisions possible for her. But we've come to a time where a lot of the friends that she's grown up with, she's 42 now, the friends have moved to residences. They're not with their parents. Everybody's in different locations. We need to find ways to bring people together that can help and stand by each other when we need help. I'm finding it very frustrating trying to get in touch with the other parents, guardians, or families of people in my daughter's residence. And they keep using the HIPAA laws as the wall. I'm calling that the wall now. I feel it should be mandated that each agency ensure, just like a public, just like the OTC school in the Bronx did, they ensured there had to be a parent, teacher, or just a parent association where they get encouraged and supported to have meetings for information, for friendship, for companionship, directions. We had speakers all the years. It was very successful at the high school, at the high school for my daughter, because the principal came to my wife and said, look, we don't have a parents association. We need someone to run it. And my wife stood up and she says, I'll be president and I'll set it up with other parents. And we had the support of the organization. We don't see that now. And a lot of us are still not familiar with all the different terms and languages being used at these discussions. And we need an opportunity to talk to another parent to parent. That's where the success is. That's where our children and our loved ones benefit the most, is when we're informed and we can make the right decisions with them. So I'm just hoping that maybe there's some kind of mandate to come out of this. All these other changes requiring at a very nominal cost, I'm sure, to ensure that we have contact information and no longer have to deal with, well, I can't talk to you about who else is going with your daughter on a trip. That doesn't make sense. It just doesn't make sense. We're the guardians, we're the legal guardians, we're the parents, we're the families. We're there to support them. Thank you.
Thank you so much for that, Edward. We appreciate it. Appreciate your feedback.
Next, we have Stephen. Stephen, you're unmuted.
Thank you very much. Hi, this is Stephen Skillman. I participated in the Region 3 public forum recently. My son has been in the OPWDD system since the year 2000 and is a resident in Region 3. Thanks very much for all the work, and I just want to make 3 points really. One was that there was some confusion, and it's probably on me, around the public forum. You know, there was really looking for feedback both on the 5.07 strategic plan and the Fmap enhanced match opportunity. And it's difficult for me to imagine doing both of those at the same time. I understand we need to multitask in life, but the enhanced match opportunity is almost definitionally kind of short term with hopefully some legs, as somebody alluded to. Let's create some kind of annuity or endowment opportunities from the Fmap enhanced match. But I would encourage us to, or you more clearly, to focus very starkly on the 30 days that we have to get the plan into CMS. By now, I would imagine there's 1 or 2 versions that have already been passed around, but to continue to get stakeholder feedback and input, to have versions 2, 3, 4 finalized before we submit the plan on July 12th. That's a lot of work. So I just trust that it's an all hands on deck, focus on the process, get a really good plan created in the next 30 days. If the 5-year plan has to sit on the shelf for 30 days, then so be it. But this is kind of a special opportunity, and I hope we're focused laser-like on that process. Lastly, I just want to echo Sarah's comments. I think the staff and the people who will execute either the programs and the initiatives under the Fmap Enhanced Match Program or on the 5-year plan, the people are the most valuable part of that. As I say, our most valuable asset walks out the door every night, and we hope they come back tomorrow. And I think each and every section, whether it's database structure or capital expenditures or DEI, needs to integrate this. How do we have excellent staff and enough staff to execute our vision for what we will do with either the enhanced Fmap program or standard annual budget? So I think staffing has got to be threaded throughout our plan that we submit to CMS. Thank you very much for the opportunity to provide my input.
Thanks so much, Stephen. I can assure you that we at the Ddac completely agree with you about the challenges of trying to do 2 very different types of processes, the strategic planning and the Fmap at the same time. We appreciate your comments.
Thanks, Michelle.
Next, we have Thomas. Thomas, you're unmuted.
Oh my God. You're not
here in half an hour when my partner comes from lunch, okay?
okay, good. Thank you.
Thomas, can you hear us?
Floor.
Hello?
Hi, we can hear you, Thomas. We wanted to make sure you knew. You have an opportunity to give us your comments now if you'd like.
Oh, well, I didn't know I was coming up so quick, so thank you.
Okay.
And I answered to Roy, so anyway, my time's running out. I really want to just endorse what Sarah said, and in terms of the workforce, my hair is on fire and I don't have that much up there anymore. So we need to address this. The agencies are in very dire straits in terms of staffing. Vacancy rates are running as high as 40% in some agencies, and well over 25 or more percent across the board, which is obviously has a devastating effect on our loved ones. Managers are working 60, 70 hours a week. Executive directors are actually going into houses to work shifts. So we are at beyond a crisis, beyond an emergency. This is a chronic emergency crisis that must be dealt with. And the fear is that the system may begin to collapse in weeks, if not months at the latest. So timing is very, very important in terms of how quickly we can pump resources into helping retain and obtain staff. My son is on a self-direction program. I'm needing a new staff person, and there's just nobody out there. And so if I'm having this problem, an agency with 10 or 15 or 20 homes, I can't imagine. It is really a critically bad situation that needs to be addressed ASAP with every resource that our Opwdb, and I say our ecumenically, I have a great deal of respect for Opwdb has to do in this environment. Thank you.
Thank you very much. We definitely hear you, and we don't want you to have any worries about losing any more hair. So we will do what we can to bring forth your concerns. Thank you.
On the list, we have Ralph, but Ralph, I don't have you connected to audio, so I can't unmute you. If you want to work on that, I can come back if I see your audio pick up. So now we're going to go to William. William, you're unmuted.
So just a quick question. The CAS is going to be implemented over the next, I don't know what period. Does the DDAC have a CAS implementation subcommittee?
Good question.
Hi, again, we don't have a specific CAS subcommittee. The CAS is a frequent topic of conversation in our systems subcommittee. So at that particular subcommittee, we really look at broad overarching issues that are impacting the way that people access and receive services and how they experience those services. So we frequently do discuss and weigh in on the CAS assessments via that particular committee, and they have definitely been a topic of conversation as we've been thinking about the strategic plan and what the system needs to look like moving forward. We certainly are aware that there's some concerns and challenges in regards to that, and at the same time, as you've heard, at least, some of our members, I don't want to speak for everybody, kind of feels that, looking at a different way of assessing acuity levels and how that impacts with funding, might be something that needs to be happening. But yes, we do discuss it at the systems committee.
One of the concerns that I found in the community is that currently, I believe the CAS is supposed to be turned on and the DDP2 stopped. And what I think the community is looking at or hoping for is that the CAS, aside from a great deal more transparency in how the CAS has created questions and so forth, and how the various answers weigh, is that the CAS scores be available for a period of time before the DDP2 is stopped, and that people be able to, recipients or be able to view the effect of the CAS scoring versus the DDP2 scoring, so that a new budget template has to be, if only a dummy template, needs to be built and available so that those scores can be put in to look at how they affect both budgeting and acuity available services before that switch is thrown. We don't want to get into a situation where all of a sudden on January 1st of whenever, the CAS is in effect and everybody has $10,000 less, because the CAS scores are not truly representative of the DDP2 scores. And the only way I know of to have that occur, if the CAS and the DDP2 dual track availability for a period of time, and my suggestion would be certainly 6 months.
Thank you, William, for that suggestion. Heard and understood. Thank you.
We have Ada. Ada, you're unmuted.
Good afternoon. Do you hear me?
We can hear you.
Do you hear me?
Yes, we can hear you.
Hello. Good afternoon. Do you hear me?
Now we can.
Yes. Hi. Good afternoon. My name is Aida Memishevich. First of all, I want to thank you for all your work you do. It is really helpful. I just want to give one of my concerns. I have a daughter with disability. She's 20 years old, and our mainly concern is housing. She lives with me, and I want her to live with me. as long I am alive. But our problem is that how much I read and how much I know, there is really not support for the families who have a child with disability and with a bigger apartment or housing. We live in 1-bedroom apartment and it's very hard. And we live in New York City. And we are really not able to get bigger space. So it is very hard to live in 1-bedroom apartment. I'm sorry. It is very hard for us to buy something, or we did apply for affordable housing, but because me and my husband, we both are working, and even though we don't have at all big income, it's really like not even middle class, but we not belong in affordable housing. We need to pay a lot of money. So is there be any support? Like, let's say I'm coming from Europe. In Europe, they have if family has a child with disability, so you're not able to find for yourself bigger space, the state support you, so you can live with your child, but your child can have her own room. You know, this is like she has Medicaid waiver. I got late for her services because I'm coming from another country, and I always was thinking, oh my God, I'm gonna do for my daughter. I will support her because this is what parents do. But then when I realized when she was 13, 14, that really I cannot give her what she needs, then I applied for Medicaid waiver and she got everything. She got multiple disabilities. So now my main concern is housing for us. So I hope there is in near future some support like for families like me. And I'm sure there is many families like me, like family. So I can continue live with my daughter, but she can have her own room. We live like in a bedroom, like 500, maybe 600 square feet. So is there any programs that we belong? I read it and I sent it email. There is really not except affordable housing that I don't belong. I need to pay really in New York City 3,000 rent for that, and this is a lot for us. We're making just around 60,000 a year. So, and that's it. I'm sorry that I was kind of surprising for me that I got to speak here. I'm again thanking you for everything. And I got some names here because I'm pretty new, so I will write emails to, I already got names for some people who were speaking before. So thank you very much for everything.
Michele, could I, this is Roger. Could I please just speak for a minute?
Yeah.
I'm going to mispronounce your last name, so I won't even attempt it. But to the woman, if you could send us an email at info@opwdd.ny.gov.
I'm sorry, can you repeat one more time so I didn't get info?
Yes, INFO.
Okay.
At opwdd.ny.gov. That's our general correspondence email address, because I don't want you to share your personal information in a public forum.
Oh yeah, absolutely. Yeah.
And we can get you connected to some folks who might be able to connect you to programs. Obviously, I don't know your specifics, but I want to make sure that we understand, and it's just been posted into the chat room as well. So send us a note with some details, and we'll get you connected to our regional office in New York.
Thank you so much. I did actually got your email. Yeah, I know. Thank you so much. Thank you. Thank you. Thank you.
Aida, this is Michele, and I just want to thank you very much. And please don't apologize for sharing very personally, what it's like to live your experience day in and day out. We need to hear more of that. And I also appreciate, as you indicated, you're speaking up for yourself, but whenever we speak up for ourselves, we know that there's other people who are, living the same experience and not able to find their way to this type of forum. So you're helping others and sharing your story, and we truly appreciate it.
Thank you so much.
Been able to connect you.
Thank you.
All right. Bye-bye.
Bye.
Next, we have Martine. Martine, you're unmuted.
Thanks, Jesse. Thank you for the opportunity to speak. It's been a while since I've been able to attend these meetings. And I I listened very carefully to Michele. I want to thank you for your opening comments for all the different subcommittees. Now, how you put that together and kind of gave us an overview of each of the subcommittee was absolutely wonderful. And I think if those comments that I know are written down, if they're so succinctly said, are given back to OPWDD, I think that they will be given the roadmap on how to continue and move forward based on those opening comments for each of the subcommittees. One of the most important things that has been said by you and by many others is listening to the families, listening to the people that are literally on the ground every day taking care of their family members and their loved ones that have disability. We really need to be in the foreground. I'm listening to what Dolores had said in her comments, and Margaret and John Maltby just so eloquently put their opening comments with their readouts of their subcommittees. And also those, I know will go back to Dr. Kasner and to Roger and to the leadership team of OPWDD. They're looking forward to seeing that information, I know, so that they kind of know where to start. So I'm going to go back to something that Dr. Kasner said about the prioritization of where funds should go. It's very difficult for the DDAC, I would imagine, to sit back and get together and say, okay, let's prioritize where each subcommittee thinks money should go, when we don't have even you don't have even the data that's owned by OPWDD, and they don't have the ability to aggregate their data and get that forward. So I am definitely behind, and echo what Sarah was saying about really understanding that data and maybe allocating funding towards being able to understand and to organize that data so they could be at the forefront of how to allocate that data. I'm also, right there with Stephen and how he mentioned about being laser focused on the FMAP. So I just wanted to support that as well. I know that there is that 5-year initiative, and I know people can do more than one thing at a time, but 30 days isn't a lot of time, and to get that all put together for that plan. So I'd like to echo that. And then I'd also like to lastly close with the self-direction subcommittee and kind of want to get an idea of where that is. I mean, it's so important. Self-direction is huge, and there are a lot of issues that are specific to self-direction. And I think a lot of the issues, if we can talk about them as self-direction, can help other areas and other people as well. So thank you so much for the time.
Martine, it's good to quote unquote see you back. Nice to be with you again, and thank you for continuing to participate in the conversation. The self-direction committee has not got, it is still a committee of the DDAC. It is one that, as we've added new members, we are prioritizing getting it kind of off the ground again. So look for more to come in regards to that.
That'd be great. Will there be people from the self-direction community, or how does that how do your committees, will they all just be from DDAC members right now, or?
Right. I think at least initially we're going to focus on our DDAC membership. That was part of the, we've just added a substantial amount of people. I think it would be good for us to identify the membership that we have that, have some expertise around that particular issue, and to get that group to gel, and then we can kind of determine from there if we need to bring in any, expertise from outside to support the group in the work.
Great. Thank you so much, Michele.
Sure.
Next, we have Ruth Ann. Ruth Ann, you're unmuted.
Hi. I'm very glad this ended up working out. Okay, so first I will say I'm an autistic woman. I'm 21. I got my official diagnosis about 4 months ago, but I was almost diagnosed at age 5. Anyways, on to a different point is we need to improve the psychiatric hospitals. There needs to be much more training for psychiatric professionals for people with autism and other developmental disabilities, because let's say they're clueless as all hell, and they can be very mean and they can cause more trauma by physical and chemical restraining at the hospitals. And also another thing is apparently the front door people told me that there's only 2 days a month that they can go through the list of people that the brand new people applying for services, and it's okay for me, but I mean, obviously I'd prefer it to be quicker, but I know there's people with other disabilities that are much more need much more supports, and that's just that's horrible that there's only 2 days a month. And I understand staffing issues, and I was a DSP in the past too. I did community rehab, and I did worked at like a respite after school place. It's called Casey's Place in Syracuse. But anyways, frankly, when I was at Casey's Place, there was the training we have to do is really no good. It really doesn't prepare you to do this like stupid online training things that really, and I have to do that. I had to do them for. I also worked at Advocates, and they're in Central New York, and the training really just doesn't help at all. I mean, I just finished getting my bachelor's degree in human services, and I mean, in some of those classes, I learned a lot more. And you get put in situations. I got so burnt out at Casey's Place. I got put in situations I have to like take care of like 4 kids at once, and like one of the girls had like food stealing behaviors or like biting behaviors, and like another kid like needs help with the bathroom, and like you just feel so burnt out. And also me as an autistic woman, I wasn't always respected by my supervisors or the other staff, because like, yes, I do need some accommodations and stuff, but also we have to value people with disabilities, can work with other people with disabilities, because I can understand their sensory experiences. Okay, that's about it. Also, I might, for Roger, I might do more emails for that planning email. And also, I would like to eventually to learn how to become part of this group. I like to learn more about self-advocacy stuff. Have a good day.
You were so concise there, Ruth Ann. I couldn't get to the unmute button fast enough, but thank you so much for your feedback. We have, again, through the systems committee, been looking at, as Dolores had mentioned a few years ago, we had made some recommendations in regards to the front door. Part of those recommendations, revolved around, taking a look at the process and how long people were waiting for determinations, and what the coordination was once people moved through the front door process and needed to kind of make that link to a CCO and eventually get connected to services. So we were recommending some, close monitoring of that entire process to make sure people got through successfully. So that your comments on that, I can't speak specifically to what you're saying is happening, but looking at that issue of timeliness of moving people through is definitely something the systems committee has been looking at. Thank you for all of your comments. We appreciate it.
Next, we have Karen. Karen, you're unmuted. You can begin.
Oh, hello. I'd like to echo William's, the issues that William raised about the CAS in terms of dual tracking with the DDP2. I think that would be very important. But I do have 2 questions that pertain to the 507 plan. One is that the previous strategic plan, I believe the year was 2011, described a public quality scale, and I've never seen a public quality scale. So I would like to know more about that, and if OPW is collecting and publicizing any quality measures about its programs. And the second question I have is that I understand that there is a DDP4 form, and that form seems like it would be one way to measure unmet needs in the system, which I would think would be very important to being able to project future needs. So I would like to know, is that data aggregated and publicized anywhere in terms of, for example, the duration of time that people are on waiting lists, and what services are they waiting for and for how many, and information like that. Thank you.
Thank you. I'm not familiar with the public quality scale, so it's something I'll have to learn a little bit more about. I appreciate you bringing it to our attention.
That's on page 39 to 40
Thank
of the
you.
previous plan.
Thank you. Thank you. It looks like we have time for one more commenter, Josie.
Okay, we have Haley, I believe. I apologize if I mispronounced. You're unmuted.
Hi, thank you very much. It was wonderful attending today's session. I was really inspired by many of the people and what they had to say. And so I want to thank them all. But my question was regarding, it was mentioned rather quickly that Opwdb's departmental bill that was passed by the Senate recently and is now going before the Assembly. And it's something to do with the supportive recognition of dual supportive decision making. Could you give me the number, both the Senate number for that bill and the Assembly number, especially the Assembly number, since it hasn't been decided by them yet?
I don't have access to that. I don't know if Roger has it off the top of his head, but we can get back to you in regards to that.
Yeah, it does not have an assembly same as, so it is just a Senate bill number, and I am looking to see if I can find the number, which I cannot quickly, but let's see if something else happens the next minute, and I can see if we can find it. But it did pass the Senate. It was delivered directly to the Assembly with the Senate number.
So that means it's passed, it's already in its law?
Yeah. No, it passed the Senate, not the Assembly, and has not, so it hasn't passed both houses, it has passed one.
Okay. And also, if I could ask, if you could give me, because I tried finding, I did some searches and I couldn't find the document. Is there a place where I can go and read it?
Yeah, I'll put in the chat room.
Okay, that'd be great.
What the link is for that, and then you can find all the bills you might want to.
Thank you. That's all. Thank you.
Okay, thank you very much. So it's 1 minute to 2. I just want to have a moment to be able to thank everybody for their thoughtful feedback and the ability to have a bit of a conversation with the members of the public at the DDAC. I know that on behalf of, again, Nick and all of our members, we appreciate hearing from you. As you can tell, the DDAC has a lot of work ahead of itself. We're at a very critical time. There's a lot of things that are happening. We are so thankful for our new members, the energy that they're bringing, and the ability to work collectively with everyone, including all of the folks that we have on the line with us from Opwdd, to make the best use of the opportunities that we have in front of us. So we hope to continue to remain engaged and be providing meaningful feedback and assistance to the commissioner as we are tasked with doing. Josie, can I put you on the spot? I think Nick mentioned our next quarterly meeting is in September. Do you happen to know the date for that?
Give me 1 second. I don't want to misspeak. September 29th.
Okay.
It's a Wednesday.
Okay, so that will be the next quarterly meeting, just so that everyone is aware of that. And Roger and the commissioner, we thank both of you for your participation today. And with that, we'll wish everybody a great afternoon. Thank you.
Thanks, Michelle.
All right. Bye-bye.